disease increases, there's also an increased interest in understanding what are the risk factors other than age that do aggravate dementia disease. So, and air pollution has been one of these risk factors that has been highlighted by scientists, and there's actually a fair number of epidemiological studies that do support a relationship, meaning we do observe higher incidence or risk in population groups that are exposed to higher levels of particulate matter. This is especially disconcerting as about 90% of the population are exposed to air pollution levels that are above the WHO guidelines. So, and in the study we just published, we systematically assessed and evaluated all the evidence out there, and we did this through the lens of the newly developed burden of proof framework. The strength of this framework is that it allows us to incorporate all the available evidence. It allows us to adjust for study-specific characteristics and in-between study heterogeneity. It also allows us to estimate a nonlinear exposure-response relationship. And finally, it also allows us to translate the strength of the evidence into a star rating that can be intuitively understood by the lay public and by policymakers. The most important finding certainly is that we did observe a robust and significant relationship between particulate matter and dementia. When we included all types of dementia, we found a 2-star rating, but when we only looked at Alzheimer's disease, the strength of evidence actually increased and we observed a 3-star rating. On the other hand, for vascular dementia, we did not find a relationship with particulate matter, and this might be either due to limited data or lack of data quality or substantial heterogeneity between the different studies. There are 2 aspects that fundamentally do determine the risk outcome score, and these are the magnitude of the risk increase and the differences in the risk increase between studies. For air pollution, the relative risk increase isn't too high, and the public health relevance really lies in everyone being exposed all the time. What is typical for air pollution studies is that we find a lot of in-between study heterogeneity. And this is possibly due to challenges in exposure and outcome assessment, as well as differences in different study designs. So in both the rather small or moderate relative risk increase and the in-between study heterogeneity put us somewhere in the middle of the evidence range, which is not uncommon for air pollution studies. When we drill down on our studies and only include studies with older adults, above the age of 60, or we only include studies that use active dementia ascertainment, we do find stronger evidence with a 3-star rating, which really indicates that when we reduce study differences or study diversity, we find stronger evidence. Generally, the impact of air pollution on dementia is a really newly emerging field, and we do need more research so that we can be more confident about our scoring.